My name is Anna. I'm going to be your student nurse today. Can you tell me your name and date of birth? Okay. We are going to do a sterile dressing change today. So I'm going to wash my hands. And I'm going to put clean gloves on. After I washed my hands, if I didn't already mention that. So with my clean gloves, I'm going to gently take off the wound dressing so that it's comfortable for the patient. I'm going to take these old dressings off and throw them in the biohazard bin. And now I'm going to assess the wound for any infection. So I'm looking for any discharge, white, yellow stuff coming out, like discharge, or pus. And I'm also looking for any new swelling or any new redness or bleeding. And now I'm going to take off my gloves and discard them. And I'm going to wash my hands again. And now, for the sake of the NTC, I did have to reuse the sterile gloves, but I would never reuse a package of sterile gloves on a patient. I would always grab new ones. And I'm just pulling up my shirt just to keep it sterile, but I'm going to wash my hands again because I had to touch my shirt. I would be wearing short sleeve scrubs, so that wouldn't happen, but I'll just wash my hands in case. And now I'm going to open the abdominal pad, and I'm going to keep my fingers on this outer edge here. And I'm going to open it slowly to keep it sterile. And then I'm going to do the same with the gauze. I'm going to keep my fingers on this outer edge here. To keep it sterile. And I'm going to open the second one. And this one is already open just because, for the sake of the MTC, like I said. But I would, again, never use an open one. And I never go above the open packages because then that would ruin the sterility. But now I'm going to open my sterile gloves. I'm going to wash my hands one more time. Oh, and before I open my sterile gloves, I'm going to put some sterile water on one of the packs of the gauze. Again, not going over with my hand or arm because that would take away the sterility of it. Just putting some sterile water on there, closing it back up. Keeping that same outer edge, I am going to adjust this just so that I have room, but I'm making sure it's not going into the sterile field of the other one. And then I'm not reaching over that. I'm going to put more hand sanitizer on, washing my hands again. And then these are open, but again, I wouldn't use any open ones. I'll take it out of the package and discard it just on the floor. And I'd open it up on the table, keeping my hands out of the sterile field and also keeping the sterile field of the gauze next to it. So I'm going to take my left hand, pick up the glove like so, and then slide my right hand in, and then take my right hand and go into the inside cuff, not touching the outside, like that. And then I'll put my hand in, like that. And now I will take the wet gauze and I'll pick it up with my now clean hand. So now I'll take that, and this one will become my dirty hand. So I'll transfer them sterilely, and I'll wipe one side and discard. Take my clean hand again, pick up the other one, transfer it sterilely, wipe the other side and discard. Take my clean hand again and pick up the dry gauze and transfer yet again, and place one, pick up with clean, transfer to dirty, and then I will take my sterile gloves off and discard those. Nope. I broke sterility. However, I should have put the big gauze on. So I will wash my hands and go grab another sterile glove set. So I will just take this and discard and open a brand new sterile pack to finish up. So again, I'm opening this. Taking this hand, picking up by this on the inner side of the cuff, like so. Putting my hand in. Picking up. And then I'm grabbing with my other hand to bring it down on the outer edge, not breaking sterility. And these ones appear to be stuck, unfortunately. But I'm still not breaking any sterility. And now, what I should have did, that I fixed now, was take the clean new one, place it over, then take gloves off, and put tape. And I'm just putting tape on the four corners for the window method. Not the four corners, the four sides. So I will finish that. And last one. And then I will add a fifth one for the name and who did the dressing change. And I would have wrote my name, my initials, the date and time I did the dressing. And then cover him back up, and I'm done.